Now, besides the lungs, we're also seeing hematologic immunologic changes. We're seeing impaired hemoglobin function, and we're seeing a very increased risk for venous thromboembolism. We're seeing disseminated intravascular coagulation, which is DIC. And these people may also have an increased risk for stroke due to the coagulopathy in the arterial system. The picture you see here is an example of Virchow's trial, which talks about the hypercoagulability because of stasis of blood flow or endothelial injury. So our individuals who are coming into the hospital with the more moderate to severe forms of the disease are not moving much, so there's a lot of stasis of blood flow, and the disease is causing endothelial injury. So as a result, what goes along with those two is the hypercoagulability. So we're seeing microvascular and major vascular clotting going on. So another key form of the disease or pathophysiology of the disease. And I just wanted to go into disseminated intravascular coagulopathy a little bit more for those who are not familiar with it, because there are lab values that will indicate a patient does have DIC. The lab values are a low platelet count, an elevation of the D dimer, elevation of fibrinogen, and a prolonged PT and APTT times. And what we're seeing in the COVID-19, and we're hearing from many countries, is we're seeing huge elevations of D dimer, and that the elevation in the D dimer is actually a marker of mortality. So the higher the D dimer, or greater than 2 D dimer, we're seeing a greater mortality risk. So it's very important to look at these lab values, and that's telling you you're having something very similar, or you are having disseminated intravascular coagulopathy going along with this COVID.